Thank you very much. I have to apologize a little in advance, though. I picked up a cold over the weekend, so my voice is a little husky, and I may have to take some breaks to get some water here. But welcome to our, I guess I'm calling it a resurrected or a rejuvenated crisis response conversation. You remember we did some of these early in the as we were all being shut down and had all these questions and weren't sure how to respond. So we put together about 10 weeks of these. We let them sort of stop as you all seem to be getting things under control. And I've been hearing a lot of questions lately, so we decided to resurrect the crisis response conversations. I am Becky Heil. I am the Southeast District Consultant, and with me today is Mandy Easter, the law, and I put down in my notes, I don't know if she saw this or not, law librarian extraordinaire. There are so many things. I could not have done this without her. Her research skills are spectacular, so I'm very grateful that she's here with me. And then you also have met Sam Bowers, our continuing education coordinator, who is serving as our producer today. So she will be hopefully monitoring chat for me as I have to sort of move off. I don't get to see that. Like all of the crisis response conversations that we've done in the past, we are not here today to tell you what to do. We really hope that what we're helping you do is ask the right questions and think about the issues that are involved with this issue. So similarly, or similar to that, the session that we did on how to reopen safely, we're going to give you some things to consider as you work through writing those policies and procedures. Like we've always done in the past, we've only got about 20 or 30 minutes of content, and the rest of the time then is going to be open for comments and questions. Today, the conversation is going to ask the question, what do I do if an employee or a library patron has tested positive or is suspected to have a case of COVID-19? I know that there are people in the room today who've already experienced this, and you've been through this with staff members or yourselves who have had to respond to a positive test. So if you're comfortable sharing later, please feel free to join in the conversation at the end. If you are not interested in sharing, that's totally fine too. And I just realized I don't have my slides up here. Sorry about that. All right. And Sam very graciously had already given me permission there. All right, so now you should be seeing the slides. And this is our crisis response conversation when staff or patrons potentially have coronavirus. So today we're going to take a look at some of the questions that are up here. At the last Friday Open Forum that I had a lot of libraries report that they did have staff test positive, or they were living with family members who tested positive or were suspected to have COVID-19. I also had a couple of phone calls from librarians who learned that their staff had been exposed by a patron. So I kind of felt like this is sort of the next big issue that was really starting to worry our librarians and our boards. So I thought this was the time to resurrect the crisis response conversations. So today we're going to look at some of the legal considerations as well as things to think about as you make decisions about your policies and procedures. One of the articles that I read in preparation for today said we really need to remember that the safety of our staff and our public is paramount. So that's kind of where I like to start. That's what this is about, is the safety of our communities. Then Mandy's going to walk us through a couple of scenarios from the legal perspective, and then hopefully by the end you're going to have some idea of best practices. We're also going to be putting together a document to kind of help walk through some of these steps, and it will be available on the State Library webpage along with some of the other documents and handouts that we have. So we're going to start today with a positive test or a potential exposure to a staff member. So the CDC says a potential exposure means means having a household contact or having close contact within 6 feet of an individual for over 15 minutes who either has or is suspected of having COVID-19. So the time frame for having contact with that individual includes a period of time 48 hours before the individual became symptomatic. So if you have somebody who was in your building and it was less than 48 hours ago and they had that within 6 feet, masked or not, within 6 feet, and spending over 15 minutes. um, with your staff or your patrons. That's kind of what they're describing as a positive case or potential exposure. So what do we do when we find out that that happens? The city's administration and the library board of trustees need to follow all the state and federal laws that pertain to the provision of safe workplaces. One of the other things, and I think Mandy is going to talk about this a little bit later on, one of the things I want you to remember, and I'm saying this because I've heard several libraries or library staff members talk about either potential exposure or patrons that had it or staff members that had it. And I want you to remember, because a COVID-19 diagnosis is considered confidential medical information under the ADA, employers are prohibited from sharing such information, and you need to shield the screening, the testing, and the diagnostic information as you would any other confidential medical information. So that means, you know, you get some kind of a note from somebody, it has to go in that locked file cabinet that everybody is supposed to have with that medical information. You need to protect that. I know it's hard when you've got other staff, but you have to remember you're not allowed to say, well, we just found out that so-and-so had a test and they have tested positive. That is confidential information and you're not allowed to share that. So here's some of the scenarios that Mandy put together for us. So the first one is, what happens now? A staff member gets exposed or they test positive for the disease. So our first question, an employee self-reports that she came into contact with someone who had a presumptive positive case of COVID-19. What should you do? Mandy, I'll let you answer that for us.
Okay. Hi, everybody. The information I'm presenting is from the perspective of attorneys. Their main objective is to prevent clients' vulnerability to legal liability and lawsuits. The information does dovetail nicely with advice from medical experts. That's actually your legal defense, since you're following the advice of medical experts, so that's good. Attorneys say to treat this situation as if the suspected case is a confirmed case. For both suspected and confirmed cases, the employees should be sent home. If an employee is obviously ill, arrange for their safe transportation home. You should also send home all employees who worked closely with an exposed or infected employee to ensure that the infection does not spread. It makes no difference whether or not the exposed or infected employee or the employees around her were wearing masks. Before an exposed or infected employee departs, ask her to identify all individuals who worked with her in close proximity, and that's defined as less than 6 feet, for more than 15 minutes during the 48-hour period after the exposure, or for the 48 hours before the onset of symptoms, to ensure that you have a full list of those who should be sent home. When sending employees home, do not identify by name the exposed or infected employee, or you could risk a violation of confidentiality law, as Becky said. If the library is in a building shared with another city department or, maybe a historical society, inform building management so that they can take whatever precautions they deem necessary. The CDC provides that the employees who worked close to an exposed or infected worker should consult with and follow the advice of their healthcare providers. They should stay home until 14 days after the last exposure, maintain social distance from others, and self-monitor for symptoms such as fever, cough, or shortness of breath. If they develop symptoms, they should remain home for at least 7 days from the initial onset of the symptoms. 3 days without a fever and no medication to reduce that fever, and an improvement in their respiratory symptoms. You are legally permitted to ask an employee to stay home or leave work if she exhibits symptoms of the coronavirus. Ask her to seek medical attention and to get tested. The Equal Employment Opportunity Commission has confirmed that advising workers to go home is permissible and not considered disability related if the symptoms present are linked to the coronavirus. The EEOC has also confirmed that measuring employees' body temperatures is permissible given the current circumstances. While the Americans with Disabilities Act places restrictions on the inquiries that an employer could make into an employee's medical status, and the EEOC considers taking an employee's temperature to be a, quote, medical examination, unquote, under the ADA, The federal agency recognizes the need for this action now because the CDC and state and local health authorities have acknowledged community spread of COVID-19 and issued attendant precautions. However, as a practical matter, an employee may be infected without exhibiting recognized symptoms such as a fever, so temperature checks are not the most effective method for protecting your staff. It's also risky for a healthy person to take the temperature of an infected person, and that the sick employee is likely to infect the temperature taker during the procedure.
So what do we do if an exposed or an infected employee refuses to leave work?
Well, you should first take a collaborative approach. Remind the employee that you are asking them to leave. Try to make them understand the reasons why their departure is necessary to maintain the health and safety of the entire staff as well as your patrons and their families. Explain any available employment benefits to them and how they can utilize them. If the employee still refuses to leave the library, consider telling them that they are now trespassing on property from which they've been banned. And if they do not leave, you will be forced to call local law enforcement to escort them off the premises. Alternatively, you can terminate the employee for insubordination. Obviously, termination should be considered a last resort. And do your best not to make a public scene. Notify employees sent home of any and all benefits available to them. If possible, it's best to prepare written documents ahead of time. Get the best information possible from your city's human resources department or your city administrator or whoever is in charge of such things at City Hall. Obviously, employees should be notified of possible work from home options. Tell them that the Families First Coronavirus Response Act requires group health insurance plans to provide coverage for FDA-approved COVID-19 diagnostic testing products and related items and services furnished during provider visits. Mandated coverage must be provided without cost sharing, including deductibles, co-payments, and co-insurance. Covered services and related cost waivers apply to diagnostic testing, attendant healthcare provider services, and facility costs. Also, plans cannot require prior authorization or similar medical management requirements as a precondition of coverage. Employees sent home without pay may apply for pandemic unemployment assistance through the Iowa Department of Workforce Development. Eligible employees are those who are diagnosed with COVID-19 or are experiencing symptoms of the disease, or a member of their household has been diagnosed with COVID-19, or they are providing care for a member of their household who was diagnosed, or they or a member of their household are in a higher risk category and have been advised by their healthcare provider to self-quarantine, or they had COVID-19 and have recovered but cannot perform their job duties due to complications from the disease. Also on August 14th, FEMA approved Iowa's application to participate in the federal government's Lost Wages Assistance Program. Iowans whose unemployment is the result of the pandemic and who are eligible for at least $100 in benefits per week will qualify for an additional $300 in weekly benefits retroactive to the week ending August 1st. The department urges employers to provide paid leave to employees who are quarantined at home if possible. Employees do not have to use up their accumulated PTO, sick leave, or vacation time to take advantage of state and federal unemployment benefits. Employers can place employees on temporary layoff to make them eligible for unemployment insurance benefits. Sometimes cities need to be reminded that the state is not charging employers for claims made by their employees due to COVID-19 related unemployment. So there's no reason for city officials to discourage the library's administration from recommending this benefit to its affected workers. The Federal Occupational Safety and Health Act prohibits employers from retaliating against employees for exercising a variety of rights guaranteed by OSHA, such as filing a safety or health complaint, raising a health or safety concern with their employers, or reporting a work-related illness. You cannot use an employee's exposure to the coronavirus or her diagnosis of the disease as the basis for disciplinary actions or termination. Be sure to respond to employees shaming or harassing an exposed or infected coworker the same way you respond to other forms of workplace bullying and harassment.
So now what happens if an employee thinks that they got the virus at work? Are they able to get workers' compensation then?
It depends. An analysis of the claim would be very fact specific. The workers' compensation system is a no-fault system, meaning that an employee claiming a work-related illness does not need to prove negligence on the part of the employer. The employee needs only to prove that the illness occurred at work and was caused by their employment. The virus would be considered an occupational disease, which means the employee must show two things. First of all, that the illness must be occupational in that it arose out of and during the course of employment. And secondly, that the illness must arise out of or be caused by conditions peculiar to the work and creates a risk of contracting the disease in a greater degree and in a different manner than in the public generally. First thing that comes to my mind is working at the circ desk. The usual test to determine whether an illness arises out of one's employment is whether the employee was involved in some activity where they were benefiting the employer and were exposed to the virus. The key point will be whether the employee contracted the virus at work and whether the contraction was peculiar to their employment. Even if the employer takes all of the right steps to protect employees from exposure, a compensable claim may be determined where the employee can show that they contracted the virus after an exposure. The exposure was peculiar to the work, and there are no alternative means of exposure demonstrated. The employee would have to provide medical evidence to support the claim. Employers contesting such claims may be able to challenge the allowance if there is an alternative exposure or if the employee's medical evidence is merely speculative.
So what would they get? What would be the workers' compensation benefits if they were successful in making that claim?
The good news is that except in rare situations, an employee diagnosed with the virus will have no significant long-term healthcare problems. Therefore, medical costs associated with the claim are likely to be limited to visits to the family physician and antiviral medications. More significant cases may involve hospital stays of 2 to 3 weeks. Compensation costs should be limited to the lost time associated with recovery and quarantine.
So now we're going to take a look at some of the things, again, that we'd like you to think about as you're working through these policies. Some of it's going to be policy, some will just be procedures, and then I like throwing in the third P word of protocols. So Mandy, go ahead and tell us about having a plan. Yes.
This is Sam. I wonder if we want to take a quick break and go through just kind of a recap, some questions that people had as Mandy was just talking now before we go on to this section, or would you rather save all the questions for the end?
We've got some more legal things a little bit later on, so maybe it will be covered there.
All right,
and
we'll hang tight.
We'll hit some of them. If that's all right, let's wait till the end.
Sounds good.
Thanks.
I've got a running list, so.
Okay, thank you. All right, so Mandy, let's talk about making sure we have a plan in place.
Okay. Hopefully your city has developed a preparedness, response, and control plan. Follow it. The first thing you should do if one or more of your employees have been exposed to or infected with COVID-19 is to contact the city's coronavirus coordinator. If your city has no plan and no coordinator, immediately contact your county Department of Public Health and follow their instructions. They will likely suggest that you close off areas in which the exposed or infected employee was working, open any outside doors and windows, and use ventilating fans to increase air circulation in the room. Wait 24 hours or as long as practical before beginning to clean and disinfect. If it has been 7 days or more since the employee has been in the workspace, closing it off and deep cleaning it is unnecessary, according to the CDC. Wearing gloves, PPE, and a gown or apron, custodial staff should clean and disinfect all areas, such as the offices, bathrooms, common areas, and shared electronic equipment used by the exposed or infected person, focusing especially on frequently touched surfaces. Gloves and gowns should be removed carefully to avoid contamination. Hands should be thoroughly washed afterwards, and any contaminated clothing diligently laundered. Consult with the library board, the city, and the local Department of Health to determine whether or not to close the library. If multiple employees develop symptoms or the majority of the staff has been sent home, it may be necessary to close in order to thoroughly clean and sanitize the library from top to bottom. If city protocols or the local Department of Public Health authorizes you to do so, utilize your normal system of public notification, such as a sign on the door or statements on social media, etc., to inform patrons that an employee has tested positive for COVID-19 and the library is working with the local Department of Public Health to clean and disinfect the library. Do not mention the employee's name or any identifying information about the employee. Health departments are responsible for leading outbreak investigations and facilitating contact tracing. Investigations involve the identification and questioning of individuals with confirmed or probable diagnosis of a reportable communicable disease such as COVID-19. Contact tracing is a process to identify, monitor, and support individuals who may have been exposed to a person with a communicable disease. When health department personnel investigate a case, they will ask the patient questions about work status and work environment, about persons with whom they've been in close contact, and locations visited during the time they could have spread COVID-19 to others. The health department may contact the employer, employees, or patrons to let them know of potential exposures. Confidential information about the infected individual, including their name and other personal identifying information, will be safeguarded and will not be revealed without their permission. You can assist your health department by providing further identification of potential contacts who worked in the same area and on the same shift, or by hosting a site visit for health department personnel to observe the workplace in order to make recommendations to help prevent further spread of the virus, and by facilitating communication with employees.
So we've kind of hit down to that contact tracing and notifications, and Mandy has actually talked a little bit about notifying the employee of their rights and responsibilities. So, as she said, we need to not only talk to the employee about what their responsibilities are once they get home, when they can come back, but we also need to remember the employees that are still in the building and what their rights and responsibilities are. And I've got a little bit more on that later. Now is the time to make sure that you have a leave policy in place. Certainly sick leave, FMLA, if you've got that, and other kinds of leave policies. You should have been working with your city all along. We've been dealing with this now long enough that hopefully if you've had to make any adjustments to that, that's all been done. But that's going to be the first place you go as you're thinking about what's this person going to do? The other policy that you want to think about, and I'm sure, again, a lot of you have been doing this for a while now, is a work from home policy. So if you had one in the past, great. I hope you were able to use it. If you didn't have one and you had to kind of put one together in a hurry in an emergency, I really recommend that you take a look at that now that you've got a little bit of space and time from when you put that together. Now that you have sick employees who are perhaps working from home, things have shifted just a little bit. Pull that work from home policy out and take a look and see, is it fair to everyone? Is it does it make sense for the positions that you allow to work from home? Does it have all the information in it that it needs to have in? So while I'm sure a lot of you have been doing this and you've allowed staff to work from home, now's the time to get that written and make sure that it's where you want it to be. So maybe consider a rewrite on some of that. So some of the other considerations that I want you to think about as we're talking about staff members who have this is, I think the staff morale becomes a big issue. You've all been dealing with this over the last few months. It is uncertain for all of your staff, both the people who are infected and the people who are left behind. Those people are wondering if they're next. They're wondering if there's going to be cuts in their future. They might be worried about people that are living at their home. A lot of employees that I have talked to have elderly parents living with them. Now they find out that they were exposed through work to a coworker who had this virus. So there's lots of worry going on. Staff is in limbo. So it goes back to what Mandy was just talking about, and that is communication is key. Communication can be things like expressing your understanding and concern for your staff.
Yes,
You want them to know, I understand that it's really scary right now. I understand that you have somebody at home. I know your situation, and I get that. Ask them, what can I do to help you feel safer? What can I do to help you as we all work through this together? Make sure that they understand that you've got that concern as well. And then if you're going to stay open, you may be short-staffed. So now we've got those people who are left who are doing twice the work. So again, you really need to support those staff and communicate with them. The other thing I'm going to talk about really quickly here is something that I talk about when we talk about strategic plans, and that is sometimes you have to let things go. What can you change or stop doing for a while? Talk to your people. What is it that's stressing them out? Is it because they're feeling like they have to do virtual story hours, or is it because they're on their feet running curbside all the time? What can you do to help mitigate those stressors? So I think that's a really big one. It goes right back to that communication. What is it? Maybe they need, a different set of breaks. That 15 minutes every 4 hours doesn't cut it anymore. So find out what are the things that your staff that are either left behind or the ones who've had to go home need. One other thing that I've found as I was getting ready for this, the University of Iowa Labor Center published an up-to-date resource titled COVID-19, Are You and Your Coworkers Safe at Work? It's a really helpful guide. It's got a lot of links in there. It links you to the CDC guidance for employers, which we have talked about several times here. I know that's where a lot of Mandy's information has come from. It also links to the OSHA guidance on safety precautions that employers should take, and then other OSHA standards just specific to COVID-19. And then it also links to the guidance for sanitizing facilities. They've also got a 4-minute video called Your Right to a Safe Workplace. So what does the Labor Center recommend? Act now. If you are a staff member and you feel that there are unsafe working conditions, they give you the tools to be able to talk about that. Make sure you do it as part of a group, that you're not the only person that's concerned about this. And what you're doing that under is called unsafe conditions. And I'm not suggesting that any of our libraries are having unsafe conditions, but some cities I know have pressured libraries to open up before they felt completely ready. So this is a resource for you to be thinking about how you're going to deal with staff that feel unsafe in the building. The other thing that they've got in there is it says, can you and your it's got the answer to the question, can you and your coworkers stay at home in order to follow the health quarantine or childcare guidelines? It also talks about what do you do if you don't have paid leave or emergency leave available. I know that's a real issue. A lot of our libraries have paid sick leave, but a lot of them don't. And so this document from the Labor Center also talks about what to do if you don't have paid leave. And some of it goes back to what Mandy outlined before with the unemployment. Let's see, what else? The other thing that I found in one of the documents is some really simple scripts that you can use. And again, this will all be part of the notes and handouts that we put up on the State Library website. But say that, excuse me, you now have to talk to your staff. You've sent home somebody who just let you know that they had COVID or they weren't feeling well. They got sent home and they just called you and said, I've tested positive. Or, they've called and said, my spouse has tested positive. So here's a sample script that you can use. You talk to your employees and you say, someone in our workplace has tested positive for COVID-19 and they have identified you as a close contact according to the CDC definition, which both Mandy and I have talked about. We are here to support you. If you're at work, please prepare to leave as quickly as you can. Once you get home, or if you're already working from home, find a place to self-isolate, monitor yourself for symptoms, and talk to your doctor. Now, how can I support you in doing all this? I really like that. It's a very simple script to address their concerns and let everybody know what you're doing and how you can help them. There was another, a little bit more formal announcement, perhaps for a slightly larger building. You gather your employees or you send out a memo. We learned today that one of our employees has tested positive for and or contracted the novel coronavirus COVID-19. Here is the area and the date where this employee frequently worked. If you develop flu or other symptoms, including dry cough and fever, please contact your medical provider and do not come to work. Notify HR, whatever. We cannot identify the employee who tested positive for the virus because of privacy laws. However, we have gathered the names of those employees that worked in close proximity during the 48 hours prior to the infected employee showing symptoms. Those employees should first consult and follow the advice of their healthcare provider or public health department regarding the length of time to stay at home. If those resources aren't available, the employee should remain at home for 14 days after the last exposure. And then it goes on to talk about some of the other things that you can let employees know. I thought those were really helpful. Sometimes we just get overwhelmed and to think about, having to write up that, how am I going to talk to my coworkers about this? So we'll make sure that you have access to that. I also gathered a few library policies from people who actually do have written, and they probably are not policies, they're more procedural. So here's one that came out of a specific Iowa library. And it says, staff who are potentially exposed to COVID-19 through a coworker will be notified ASAP and will not be allowed to work on site. They are expected to self-quarantine until the test from the coworker comes back negative. Another one says, staff who are exposed to COVID-19 are expected to notify the library director as soon as they're aware of the exposure and should follow the most current CDC guidelines. I particularly like this because instead of saying it's automatically 14 days or it's automatically 48 hours, it says we're following the latest guidelines. And so I particularly like that language in there. Staff will be required to be tested ASAP. Let's see, there's some other ones that are in here. These are getting a little long. Here's another one. Staff who are diagnosed with COVID-19 are expected to follow the CDC guidelines requiring self-quarantine and will be allowed back to work on site based on the most current CDC guidelines. For those with symptoms, this is currently at least 10 days since symptoms first appeared and 72 hours fever-free and improvement of symptoms. And again, this is information that has been a little fluid. So you may have that in your policy and you may have to adjust that as the CDC changes that. From the Vermont Department of Health, they gave this information to libraries, and I found this. They talked about, how do you answer the question, when can they return to work? If people are symptom-based, they maybe haven't had a test, but they have all the symptoms, they talk about using a symptom-based strategy. So it's, their policy was you can't have a fever for 24 hours, and your other symptoms have to have improved, and you have to have at least 10 days since the symptoms first appeared. So that's one way if it's symptom-based. If it's just time-based, they don't have any symptoms, but they have had a positive test or they've had an exposure, they are to be excluded from work until 10 days have passed since their first positive test if they haven't developed symptoms. Another thing, and I think Mandy said this earlier, but I've seen this over and over again, you should not be requiring a negative test or a letter from the Department of Health for them to come back to work. That's something that everybody is recommending you not ask them to do that. Let's see, I think that is it for there. Yeah. So that's sort of the scenario of what happens if an employee either is exposed or has let you know that they have the virus. Now what happens if we have a patron? Patron calls you and they say, oh, I just tested positive. I was in your building yesterday. Or maybe you as a library get the call from a contact tracer that somebody visited the library and they've tested positive. We're going to look at a couple of those scenarios next. So the first one, patron has COVID-19. You hear that one of your patrons has COVID-19 or lives with someone who has it and they were recently in the library. What should you do? Mandy?
Well, first of all, don't act on rumors. If you have a report from the patron himself or the County Department of Public Health notifies you as part of its contact tracing efforts, consider it a legitimate exposure and follow the department's instructions. You will likely have to figure out whether and which employee or employees were significantly exposed to this particular patron. And significant exposure means closer than 6 feet for more than 15 minutes. And initiate the process we've already discussed.
All right, so the second question then, and I know you've all heard this, it's all over town that a woman in your community has tested positive for the coronavirus. She was in the library a few days ago. Your staff thinks you really need to let the public know by posting that fact on the Facebook page. Should you do it?
No, do not do that. The U.S. Department of Health and Human Services Office for Civil Rights says that by law, only public health authorities may communicate information to the public about individuals who pose a threat to others' health. And even then, that information must be general enough to protect the individual's personal identities. Sometimes the Department of Public Health does decide to broadcast a notification in the public's interest, such as confirmed cases of school personnel in particular buildings. But those announcements are very general too. When the media announces that a celebrity is sick with COVID-19, that celebrity has voluntarily disclosed his or her own diagnosis. Public health entities are permitted by law to exchange individuals' personal identifying information with each other in certain circumstances, but it would never be a public library's place to make an announcement like this on social media, and doing so would risk adverse litigation. And I also wanted to tell you that the Iowa State Bar Association continues to host a COVID-19 legal information hotline operated in partnership with Iowa Legal Aid and the Polk County Volunteer Lawyers Project to help Iowans with coronavirus-related legal issues, including employment concerns. So if for some reason you cannot ask your city attorney such questions, you may call the hotline. And there's the number.
So now we're kind of back to some of those policies, procedures, and other considerations. And this is a little bit longer than I intended here today. So the CDC has guidelines for employees returning to work. We've talked through some of those. They have a list of what they call considerations for returning to work. Are you or someone in your household at an increased risk of severe illness? You might need to take extra precautions. And I really like that because it doesn't say this is a blanket rule for everybody. This is what everyone has to do if you've had a potential exposure. They say if you are higher risk, you might need to do these other things. They also have you ask the question, are you the primary caregiver for your child or someone else? If so, there are some other things to think about. Are there ways that you can minimize the number of people that you interact with? That again comes from the CDC. Before you come back to work, start thinking about those questions. And then all the things that we have heard over and over and over. To protect yourself and other people in the workplace, stay home when you need to, monitor your own health, wear a mask, maintain social distance in shared spaces, wash your hands, cover your coughs and sneezes, avoid sharing objects and equipment, and clean and disinfect frequently touched surfaces and objects. So those are kind of their latest recommendations for getting back to work. This doesn't specifically address, this next piece here, doesn't specifically address what to do if you've had a staff exposure, but I want to make sure everybody's aware of the Project Realm or Realm project that was done in conjunction, oops, I've got that someplace here. Where'd it go? So it's reopening archives, libraries, and museums, and I've got the link there for their information hub. They just finished their third test. This project is a research project on how long the virus survives on materials that are prevalent in libraries, archives, and museums. They have drawn on research to produce authoritative, science-based information on how or if materials can be handled to mitigate exposure to staff and visitors. So like I said, doesn't specifically address what we wanted to talk about today, but I think it's something that I want to make sure everybody knows about. So here's just a few resources that I used as I was kind of putting this together. The Library of Michigan has what they call a sample positive case protocol. This is specific to Michigan, so it's not all information that we can use, but I think some of the steps that they go through in the scenarios could be really helpful. So we will have a link to this, but we are also planning on putting together something that is specific to the state of Iowa. One of my favorite things that I have been pointing people to all the time is that AIHA, oh, and I left off, I forgot what that is. It has to do with the Hygienic Association, and they actually put together a 2 or 3 page document on reopening guidance specifically for libraries. And it's got lots of really great information on there about cleaning and disinfecting. So I thought that was a really good one. I really recommend people take a look at that one. Obviously, the CDC has tons of things. They've got guidance on quarantine. The place that I found the most helpful was under the general business information. They answer a whole lot of questions in there that are for businesses and small offices, and I think those are really helpful for you to take a look at. I'm a little disappointed. The Society for Human Resource Management, a couple of days ago, I went there and I got all kinds of toolkits and lots of really good information. I went back this morning, I think it was, and they had locked down some of those pages, and so you can't get to it unless you are actually a member of this human resource place. And then I went back today and they had locked down even more. So I'm not sure if it's because I hit the site 3 times, but you might give it a shot and see if you can get any information. They had some really nice checklists and things in their toolkit that they had. And then the document that I talked about earlier, the Iowa Labor Center has that document called "Are You and Your Coworkers Safe at Work?" So we are to the question portion. So I am going to stop sharing and I will ask Sam to kind of talk. I'm probably going to mute because my guess is your questions are all going to be from Mandy. So I'm going to let her answer most of these unless it's something I can actually go in there.
One quick question, Becky. You mentioned several sample policies. Are those going to be part of the resource list you're distributing?
I don't have a whole lot of libraries that gave me their policy, so if you have one, I would love to see it. What I'm thinking is I want to take out identifying information, and instead of actually just shoving a whole policy at you, letting you see bits and pieces from each of them. I haven't put that together yet, so I don't know exactly what that's going to look like. If you want to go ahead and share your whole policy, let me know and we can put links to that. If it's on your webpage, we'd be happy to put links to that.
Yeah, that's great. We did have someone asking after the sample policies. Mandy, a lot of the questions that we had came around this idea of what if we're we have 2 or 3 people in our library and, I tell staff person A, hey, someone got infected. A staff member is infected and then staff member B doesn't turn up. It's pretty obvious who that person is. So what do we do for these small libraries?
Well, there's nothing to be done. I mean, that will happen, but you won't get in trouble for saying, what you said. What you'll get in trouble for is naming the person. So, people can figure things out, but you can't get in trouble for, figuring things out. So they just have to be careful not to name the person.
And is it kind of the same thing if you're a solo library and you put a sign on the door, everyone's going to know? Do you have to be as specific? Maybe the question I would ask is, do you have to be as specific, or can you say closed due to illness?
Yes, nobody's requiring you to put a sign on the door that says that a staff member has tested, positive for COVID-19. Nobody's telling you to do that.
One of the things that we talked about earlier that I think is really helpful, and I actually had this written down in my notes and forgot to say it, at that reopening time, we talked a lot about how to reopen your library safely. We talked a lot about the idea of a dial, so that instead of saying we're closed and then we're going to this phase and then we're open again, you have to be thinking about, we may be partially open and something happens and we have to close it back down. So if you've been using that language already on your Facebook page, you may have said community spread has gotten worse, or according to our policies, we now have to shut back down to this stage. That can help you again. you don't have to say it was a staff member. You can just say, based on our policies, we now have to shut back down to this stage again. So I think that was a really good question.
Yeah, that's a good
So
point.
this is Nancy, and I have a thought too about your small libraries where you have very small staff. That's a good time to talk with your staff and say, we cannot share this name, so make sure you're also not sharing it outside the library, and just have that conversation with them and talk about that privacy. You know, patron privacy is a big thing, but so is employee privacy. So it does, yes, they're gonna know, but make sure they don't spread that even farther then too.
There was another. Oh, go ahead, Becky,
can I do one? I had one that came to me that I want to get Mandy's take on a question. Can we require, because we talked about this, can we require a return to work release from a healthcare provider? And if a staff person calls in ill, can we ask if they have COVID symptoms?
Yeah, the answer to both questions is actually yes. And there was a change in that because originally the CDC made it very clear to not ask for a return to work note from the doctor because the doctors were overwhelmed. And they said, you know, you're asking for something that a doctor is not going to really be able to write anyway because they don't have time to see patients. They're not allowing them to come into the office and things like that. You know, you had to do telemedicine and what have you. So they issued that statement right at the beginning, like in March. I read just this week that they have backed off on that and said they still don't recommend it because you're asking your doctor to say something that we don't know enough about this disease that the doctor can definitively state, hey, go back to work and you'll be fine and everybody around you will be fine. But an employer is not prohibited from asking for that. They just said it, you know, it's not recommended. And you can ask, you definitely can ask if an employee has symptoms of COVID-19, or you can say, you know, you can ask them if they have symptoms of the flu too. So, because the flu is very communicable.
We have about 15 minutes left, so I'm just looking through some of our questions here. Is unemployment only for full-time staff?
No, not related to COVID-19, no.
Okay. And then Mandy, we've also had a number of questions. Would it be possible for us to get a copy of your notes to accompany this recording?
I don't typically give my script out, but I would be happy to, you know, coordinate with Becky to get the meat of my presentation, you know, in a paper form. Go ahead.
What I was thinking is if we could maybe add some of the questions that we asked to the FAQ page. I think we've got some COVID FAQ pages, and so I was thinking that might be a way to get some of that information out there.
Wonderful. And we are recording today's session, as I've said several times in the chat, so you will be able to rewatch and specific sections as needed to take notes as well. If a staff member travels out of state to a higher concentrated area of cases, is there anything that we can do at that point? Ask them to quarantine or stay home?
It's legal to do that. You may.
Part of your policy, perhaps.
It has to be. Yeah, it has to be a policy that's applied on a non-discriminatory basis. I mean, you know, if somebody goes to Texas and comes back and you ask them to self-quarantine, you should also do it if they, you know, go to Illinois or something. You know, it's dangerous to pick and choose the states. So apply the policy uniformly.
Another question that maybe is information on the CDC site, and I think we did address this briefly. If you get exposed, take the test, and comes back negative, can you go to work immediately, or do you still wait 14 days?
They're recommending to wait the 14 days because, or, you know, I think there are some places are saying 10 days is now the number, but I could not find that in writing. But the problem is that there is such a high percentage of false negative tests that come back. So just testing negative does not mean that you are not a carrier. So people have a right, or employers have a right to say, you know, if you have an exposure, then you need to stay away.
For 14 days.
Mm-hmm.
Are there we might have covered this, are there recommendations for indirect contact if someone in their house is quarantined because of possible exposure, but the employee themselves was not with the person who was positive specifically?
Well, you know, when you live in the same house, you're obviously probably touching the same surfaces. So that would be my concern as an employer is, you know, well, okay, so you weren't standing next to this person when they started to cough, but you're sharing a bathroom, you know, or something like that. The employer has a right to request isolation if the person lives with somebody who has it. So I guess it'd be up to the employee to convince the employer that somehow, you know, maybe they have totally different floors in the same house or something. I don't know, but maybe there's a way to convince the employer that they were not exposed.
In our last 10 minutes, if anybody would care to unmute and ask a question, you may. I just ask that maybe you put that in the chat so we don't have 130 people unmuting all at once.
This is Sarah. I had that last question. I just wanted to clarify. It would be an employee, they're not in the same household as someone who is sick, but someone in their household was exposed to a third party that the employee wasn't exposed to. So it's not that they're living in the household, they're living in the household with someone with a potential exposure.
The CDC says that exposure has to be treated the same as an infection until proven otherwise. So the person living with somebody who is exposed is considered by the CDC to be the same as the person who lives with somebody who's infected, at least for the 14-day period.
Thanks.
Mm-hmm.
We also have a question here about non-essential and non-essential workers. Does CARES Act only cover paid leave for essential workers? Thought I remembered reading it covered non-essential workers too if they test or diagnose positive. And do you know if that expires at a certain month or time?
Not at this point. It's still active, and all you have to do is go to the website for the Iowa Department of Workforce Development, which is www.iowaworkforce.org, and it's right there on the homepage.
Got a couple of questions, comments, concerns about schools starting as well. Of course, now we may see some additional cases. If your kid gets sent home from school due to potential exposure, do you stay home as well?
Well, to me, that's similar to Sarah's question where, you know, somebody's living with someone who was probably exposed, and according to the CDC, potential exposure is the same thing as, you know, having it. So talk to your public health department would be my recommendation.
Yeah, we'll all be crossing those bridges in interesting ways, I'm sure, as teachers and students and bus drivers and lunch professionals and janitors and everybody's all moving around more.
And I do want to say one of the things that I've been hearing, again, at those Friday forums, or just from conversations with librarians, one county will contact their public health and ask a question and get one answer, and somebody in a different county over will ask the exact same question and get a different answer, which is really frustrating. As a librarian, we want to know the right answer, and getting two different answers can be really, really hard. And it seems to depend on, you know, who's running the building and who they're listening to and, you know, what advice they're giving. So I think for me, I just keep going back to, you have to get all of the information that you can, wherever you can get it from, vet that information. You know, is your county health being run by, you know, somebody who's got a degree in infectious diseases, or, you know, somebody who used to be a baby nurse? You know, look at all that information as you're making those choices, because I think Mandy has said this over and over again in the past. We don't get in trouble when we make those decisions based on the best information that we have. And if that's what our legal concern is, am I going to get in trouble for it? If you have done your due diligence and looked at all the information and made those choices, you can feel comfortable knowing that you did the best that you can with the information you had, as well as the community then also knows that you're doing your very best as well.
If you
Mhm.
don't trust your county Department of Public Health, which is a very sad thing to have to say, but if that's the case, then call the state Department of Public Health. And Becky's right in that if you made a decision based on what your local Department of Public Health told you and it ended up being problematic or caused some liability for you legally, your defense in court would be that you relied on an expert, and then the liability would shift to the local Department of Public Health.
But building those relationships all along here is really an important part. Oops, excuse me, I lost my question left. I think we've hit most of the questions that I saw come up in the chat. We do have 5 minutes left. We do have someone in the chat here. Someone who had specifically told her husband was positive. Can we ask her to leave? She was in briefly. I was behind the plexiglass. We cleaned like heck when she left.
Well, can you tell her to leave? I suppose you could. I mean, you could say, you know, gosh, you're contagious. You're infecting us all. You're probably an asymptomatic carrier. I mean, I have not read any rules on that. I did have a library contact me this week that said that their city wanted them to kick out anybody who, you know, seemed to be sick. And the librarian was just like, that, you know, I can't do that. I can't tell somebody to leave. We have a sign on the door that says, you know, if you've been exposed to COVID-19, don't come into the library. And she said, they've seen the sign. I just can't force myself to give them their marching orders once they're through the door. So I don't know what to say about that.
Mandy, I know we've touched on this on Library Talk and other places, but can you quickly address requiring masks legally or not?
The latest information is that you can certainly require your employees to wear them, especially if they are in direct contact with the public. You know, you can say, well, when you're at the circ desk or the reference desk, you have to wear a mask, but when you're back sitting at your desk in your cubicle cataloging, you don't have to. You know, you can certainly say that. Asking patrons to wear them, I would use the word ask. I mean, people are getting shot in grocery stores for telling people they have to put on a mask. You know, you really don't want to put your staff in that position to have to be enforcers. This is addressed at length in the State Library's COVID-19 response website. So you might go there and read the pros and cons of it. It depends on where you live, I think. There are some places where I think the pushback from the public would be greater than in other places, and only the librarian knows his or her community well enough to make that assessment. So
the other thing that I really like are the libraries who, yes, they've got the sign on the door, but they provide options. Mm-hmm. And they say, you know, we're sorry that you're uncomfortable, that you don't feel like you can wear a mask or you would prefer. Here's what we can do for you. You can call the library and we'll pick books out. We'll do curbside. You know, you can join our program, you know, whatever it is, virtually, and give them the options of here's how we can serve you if you choose not to wear a mask. And I really like that approach a lot.
Yeah, they were doing that at Target when I was there this weekend. You know, as you're walking around, they require a mask. And as you're walking around, they say, you know, thank you for wearing a mask. If you prefer not to wear a mask, you're welcome to place an order online and we'll help bring it out to your car, you know, things like that. So.
Well, Sam, unless you're seeing other questions come through, or
I
again,
did see one, and I was muted as I was talking. There was one question on if the city is not requiring masks of all of its employees, can the library require masks?
Yes, the library can make policies.
Good enough. I think that's that's the vast majority of the questions I've seen. I put a link to all of the COVID-19 resources There are some sub pages and links off of that main page, but I would encourage folks, if you still have questions, to head there and look it over. I know this was a lot, but we will get the recording up as soon as we can. Look for it in the next couple of days even. And many thanks to Mandy and to Becky for rounding this up. I just want to acknowledge that there are lots of question marks in this whole process, obviously, and the state library is here to help you guys. Even if we don't have all the answers, we want to refer you to the most up-to-date information that we're aware of. And we're not public health folks, but we are on your team in your court on this. So hopefully we had some helpful info and some good resources. We'll send the resource list that Becky is compiling as well, with a link to the continuing education survey.
Can I put in a plug as well? Like I said in the beginning, we sort of resurrected the crisis response conversations because I felt like this was a really big issue that was hitting right now. If you have other really big things that are forefront in your mind that you really feel like you need information on, let your district consultant know, and we're happy to do another one of these if it warrants it. These are for you, and I love the title. It's your response to this crisis, and so whatever the crisis is currently in your building, let us know so that we can help you respond to that.